Hello. Today I'm interviewing Anola Bermudez-Millan, who is a professor in the Department of Public Health Sciences, and I'm going to be speaking to her about her life course, her career, including her research and her teaching. Good morning, Anola.
Good morning.
I'm hoping we can have a nice conversation today about where you've come from and what you do currently. And maybe you could start, you are the only faculty member I know who starts her professional talks with some background about your own life. And I'm hoping maybe you could begin with a little bit of that for us today.
Sure. As you mentioned, my name, Angela Bermudez-Millan. I'm from Puerto Rico. My country of origin is Puerto Rico. I was born in Arecibo, which is a city in the north middle of the island. I was raised in a very rural area of Puerto Rico. During my childhood years, I want to say one of the most important things that happened to us is moving to the rural area. We used to rent a house in the city of Arecibo, and then we moved to the rural area of Puerto Rico. And in that small little town, my dad built a house. And that's the house that I was raised. Everyone in the community knew each other. It was very humble environment where I grew up. Everyone around us, help each other. During the times that we moved to the house, we did not have proper sanitation because it was a new town being built, what they call el barrio. So we were able to, within a year that we moved there, my dad was able to, build the house and some of the sanitation and all the proper plumbing and all of that. So my background is thinking about my early childhood and how we were raised and how we grew up that's what brings me to the field of public health and public health nutrition and issues of food access and food insecurity and how it might affect the way people eat and the way people behave, and behaviors.
And how long did you live there before coming to the mainland?
So I was there until 18 years. So I was raised in Puerto Rico, moved to the United States when I was 18 years of age.
Okay, so you went all the way through high school?
And actually college, yeah. Uh-huh. So I went to the University of Puerto Rico for 2 years. I graduated high school when I was 16. I was really
congratulations.
When I graduated high school, and then I was lucky to have a grant, it is financial aid, to attend the University of Puerto Rico for 2 years, and live in the city with my aunt, who played a major role also in my life. My aunt was the first person in our family who had a college degree. She was a nurse. So she was, very, engaging and very, she was a person that I, count on. And during especially those first 2 years, she was part of my development.
And what do you attribute? Many people who grow up in as you said, I think, modest environment in a rural area, maybe it's hard for them to get to higher education and to have the success you have. What do you credit with you being able to do that?
I think for me is the educators that were part of that trajectory. In elementary school, I have people that really push me to do better. My parents only have elementary education. Like my mom only have 4th grade elementary education, and my dad had his GED. And they were always very pro education. My parents were like, we didn't get a chance, but you guys you should get the chance, whatever chance you can get, just take it. I have teachers in elementary school that saw the potential in me. One of the reasons why I skipped, a grade was because one teacher recommended it, because I already knew how to read, how to do math in first grade. So I didn't did first grade. I went to second grade, and it was a lot of it was self-taught. And my dad reading to us. He was. But teachers were always there, elementary, middle school. I have a great, fantastic math teacher that I still communicate with him, Mr. Bravo, who was always saw the talent. It was just not me. There was a group of us that he always saw the talent of us, and he will always, you guys can do this, let's do it together. I will, even during high school when I couldn't understand, certain topics, geometry, I will go to him. I will go to my middle school. Hey, Mr. Bravo, can you help me? Just guide me with this, So there were people in my life, I would say a lot of educators that play a vital role in my development.
Well, I think you're very fortunate for that, especially the math, because math can be taught very poorly, and children can become afraid of math very early and then not continue with it. So yes, you're very fortunate. So you went to 2 years in Puerto Rico for college, and then you went here?
My trajectory is interesting. I wanted to come to the States when I was 16, but my parents were afraid of me at 16 coming to a state. So I have offers from different universities, acceptance letters, what they call. So I waited until I was 18, then I transferred. One of the reasons why I decided Connecticut was because a neighbor of my mom in my hometown knew that person, have a sister that lived in New York, in the Bronx. So then I decided to apply to a location that my mom felt comfortable. Okay, at least you have someone in the States to provide some home environment. So I was able to move with this person, in the Bronx. I lived with her for a few months. Then I moved to Bridgeport, to Connecticut. So that's how my trajectory ended up here in the States.
And at that point, did you know about public health? Was it your plan, or was it?
It wasn't my plan. My plan was, I was fascinated with the chemistry as a subject.
Okay.
So I actually studied in the University of Puerto Rico with chemical engineering, and then I transferred to, that was my transcript, that's what it said, my official transcript was chemistry. And then when I got to UConn, because from Bridgeport I went to UConn to finalize my undergraduate degree, I ended up taking chemistry classes, and then I ended up taking a nutrition class.
I see.
So that class led me to the path of public health nutrition. So I was introduced to public health nutrition by my major advisor then during my undergraduate degree, and also someone that worked at the department, Miss John Siegel. At that point, she came and talked to me about the program.
And then what led you to pursue a PhD and to do research? I mean, you could have done something else, more practice-based. So I'm just curious.
I think for me, is about understanding community experiences. So when I have to take an community nutrition class during the summer when I was an undergraduate, and I did my community nutrition class in the city of Hartford. That's when I was introduced to Hartford, because I was living in the very rural, in a Storrs campus during that time. So when I started in the urban setting in the city of Hartford, I realized that it is really difficult to complete a nutritional assessment, a dietary assessment, such as a 24-hour recall or a dietary recall, if you don't understand the social determinants
Yeah.
that people face. At that, I remember the study that I was doing. Well, I was introduced to by collect data was a study about childhood obesity, or the needs of it was a community needs assessment with related to nutrition and anemia. And when I was collecting the data, I was interviewing the mom. It was a 24-hour recall. As you know, you asked the questions about in the previous day, tell me a little bit of what this child had eaten. And the mom started to cry, like she was very emotional. And the mom in Spanish told me, she was also from Puerto Rico, was there for some years. And unfortunately, her husband was laid off at that time. So they were going through, struggles during that time. So she actually told me, I'm going to show you something. So she opened her food pantry. That's when I became even more, interested in the field of food insecurity and research and how it affects. So I remember I was not able to complete the dietary assessment. I ended up calling my major advisor, at that point. I ended up driving her to a local food pantry. She didn't know what a food pantry was. So that's how I ended up working with my former mentor at the Hispanic Health Council, Grace Damio, and we were able to get this family the resources that they needed until he was able to find a job during that time. The husband was able to find a job.
Well, that's a really profound story, and I think it explains your motivation. And then you got your PhD, and then you went into an academic career. So some people don't. I chose to not go into academic career for a while, and then I came back. But what kept you on the academic track once you had finished your degree?
So I completed my degree, and then I ended up doing a postdoc at Hartford Hospital with a breastfeeding program. Okay. And then I ended up working for nonprofit for a year. Okay. So I was doing research at a nonprofit organization, the Hispanic Health Council, for a year. Then I was actually, someone called me and it was my former major advisor. He called me and he said, I have a collaboration with this faculty at UConn Health, and they're looking for a postdoc. Are you interested in switching and doing more academia, doing work in an academic setting? That's when I started thinking about academia. So I went from that community-based program, this research program at the Hispanic Health Council, came here to UConn Health and was completing this stress management study among Latinos, RO1 intervention, doing a lot of the coordination of that study, creating a lot of the intervention materials with the mentor. Then I met David, and then David asked me, Dr. Gregorio asked me, would you like to teach a class in the program? So that's how I started academia. Yeah. However, when I was completing the doctoral program, I was a TA. So that also gave me some of the tools to be able to teach. So I was a TA for several years during that doctoral program at the Nutritional Science Department.
Well, you're confirming what I've thought for a long time. A lot of academia is connections. People know each other, and then it sort of leads to something more, which is not a bad thing. It can be a good thing. Yeah. So you mentioned teaching. I think of you as having both research and teaching, and I think teaching, I think I'm correct about this, teaching is something that is very important to you, and I'm wondering how it came. You've explained a bit how you became interested in research and nutrition, but what made teaching so important to you and made you interested in investing the level of energy and commitment that you have to teaching?
I think teaching for me is doing a lot of mentorship. A mentorship, being a good mentor to the students, to the next generation. I feel like I always think about all of the teachers that were part of my life who play a vital role in my development. And I feel it is actually what motivates me to also become a teacher, for the students, but also to connect them and make them view the world as it is. Like public health is a field that you have to understand people's background, understand what are some of the challenges and barriers that people face, how to be healthy. And I think students exposed to that kind of environment and to those kind of experiences help them to be better human beings, to also become advocates for those that need it the most, and to teach others how to become more to advocate for themselves. I became, when I was, in my, this experience as an undergraduate student that I mentioned with the lady who did not have food in her food pantry, it kind of led me to that advocacy piece. Like, how can I help others to understand what they can do and how they can break some of the barriers and those that they face in life. And I truly believe that education is one of those things that that can be achieved if you get proper mentorship. And highly, as from my summers, from my experiences and my engagement, I like to always, the piece of me that is really important is to also encourage minority students to go farther than they imagine they can be. And the reason for that is because the teachers that I have in my life motivated me to do that. I was just, when I was, thinking about a college degree, I was just thinking about a bachelor's degree, and that was it. Like, I wasn't thinking about higher, a master's degree or a PhD program. At that moment in my life, I was like, okay, my parents did not have proper education. They keep encouraging me, you should go to college to do better for yourself and the family. So I ended up going to college because of a lot of those teachers, and they motivated me. Like, I didn't even thought I would go to my master's degree, and there were people who were like, you should do this. You should get your master's degree in public health. And those are the kind of mentors that I feel had taught me how to be a mentor to others. I mean, even the challenges that some of our students face, I feel like they're my challenges. So I want to be there for you to be the best person that you can be. So let's try to work together in, okay, if this is complicated, what can we do to make it less complicated for you? So I feel that it is really important to help and pass the baton to others. And so that's what my motivation is, give it back, pay it forward.
Right. Well, I think that's beautifully said. I think all of us in public health want to do these things, but probably most of us don't come from the path that you've had and still remember that path and respect it and think about people coming up with a similar path. And to me, that is something very valuable that you bring to our program and to your work. And I appreciate that.
Thank you.
Well, I think you're a great example to your students, and and making a contribution to the communities you work in. So thank you for that, and thank you for the conversation. And yeah.
Thank you so much.